Hello, you are watching the Health Today channel. Have you noticed how a woman's body subtly changes after the age of 60? These are changes that are rarely discussed, yet they can significantly affect health, well-being, and even self-esteem. The skin becomes thinner, hair changes, sleep is no longer the same. But there is one part of the body that often suffers in silence, the intimate area. After the age of 60, the vagina and the entire pelvic region undergo profound changes. Natural lubrication decreases, protection against infections weakens, the vaginal pH balance is disrupted, and the vaginal walls become thinner, more sensitive, and more vulnerable. The risk of infections, burning sensations, pain, and even urinary incontinence increases significantly. The most concerning aspect is that these issues are rarely addressed openly. Many women suffer in silence and often do not realize that these symptoms have a medical name, a clear cause, and, most importantly, effective solutions. A study published in the Journal of the American Geriatric Society followed more than 2,000 women over the age of 60 and found that over 70% reported unpleasant symptoms in the intimate area, yet only 15% sought help or received appropriate guidance. This means the problem is widespread, but silence is even more prevalent. That silence gradually undermines the health of millions of women due to lack of information, fear, shame, or the belief that these changes are simply normal with age. They are not. And that is exactly why this video exists. Today, Ksenia, a specialist in women's health after 60, will explain, in 4 important sections, the essential care measures every woman over 60 should know to protect her intimate health. This discussion will be natural, respectful, and clear, without taboo or shame, because your health can no longer wait. Please write in the comments how old you are and which city you are from. This helps me understand how far this message reaches and who is joining me in this mission to restore dignity, comfort, and health to mature women. The truth about the vaginal mucosa after 60. As women age, the body undergoes many changes, but few are as overlooked as those affecting the vaginal mucosa. After menopause, estrogen levels, the primary hormone protecting this area, decline sharply. As a result, the vaginal walls become thinner and more sensitive. Natural lubrication decreases or disappears. Vaginal pH changes, disrupting protective bacterial balance. Blood circulation in the area decreases, making tissues more fragile. The risk of pain, infections, bleeding, and irritation increases. This condition is known as postmenopausal vaginal atrophy. Many women realize something is wrong only after years of silent discomfort. Few know that there are natural ways to support and strengthen the vaginal mucosa. With regular care, it is possible to restore vitality to the intimate area without synthetic hormones or expensive procedures. 3 simple actions that help protect the vaginal mucosa after 60. Use of natural plant oils. Unrefined, cold-pressed coconut oil, for example, can help restore local lubrication and provide protection against microorganisms. Activation of blood circulation. Light walking, gentle pelvic muscle contractions, and even soft touch to the area stimulate blood flow, nourish tissues, and support recovery. Nutrition rich in phytoestrogens. Flax seeds, fermented soy products, yams, and chickpeas contain natural compounds that help balance the effects of hormonal decline. A study published in the Brazilian Journal of Gynecology and Obstetrics showed that women who regularly used coconut oil in intimate care reported significant improvement in lubrication and reduced discomfort within 30 days, without side effects. Vaginal pH after 60 and how to restore balance. The intimate area has a natural pH that protects against bacteria, fungi, and inflammation. In younger years, vaginal pH is mildly acidic and supported by beneficial bacteria, lactobacilli, forming a strong natural defense. After menopause, reduced estrogen levels disrupt this balance. Lactobacilli decline, the mucosa becomes more vulnerable, and natural protection weakens. This can lead to unusual discharge, persistent itching, burning sensations, and recurring infections. These symptoms are often mistakenly attributed to poor hygiene, increasing shame and silence. In reality, this is not a hygiene failure, it is an information gap. Natural ways to help restore vaginal pH. Fermented foods such as kefir, unsweetened yogurt, and sauerkraut support healthy microbiota from within and strengthen local immunity. Avoid regular soap, most soaps are alkaline and irritate the mucosa. Choose gentle intimate cleansers with acidic pH. Sitz baths with apple cider vinegar. 1 tablespoon of organic apple cider vinegar per liter of warm water, for 10 minutes twice a week, may help restore pH and soothe mild irritation. A study in the journal Menopause found that women over 60 who addressed vaginal pH balance experienced a 63% reduction in urinary tract infections and recurrent candidiasis. Vaginal dryness, sleep problems, and reduced libido. Have you noticed irritability, poor sleep, or loss of interest in daily activities without knowing why? Sometimes, the cause begins in the intimate area. Vaginal dryness is not just physical discomfort. It reflects declining estrogen levels, the hormone that also regulates sleep, mood, desire, and serotonin production. When this system weakens, sleep quality deteriorates, fatigue increases, emotional connection fades, and intimacy may become uncomfortable or painful. Science shows that natural methods can help restore these functions. Omega-3 fatty acids and vitamin E, from flaxseed, sunflower seeds, sesame oil, support tissue hydration and hormonal balance. Adaptogenic plants such as maca and ashwagandha may support energy, desire, and sleep quality. Gentle external use of natural oils, almond or rosehip oil, can provide comfort and hydration. A study published in Complementary Therapies in Medicine reported that women using maca extract for 6 weeks experienced improved lubrication, increased sexual desire, and deeper sleep, without side effects. Common hygiene mistakes that harm intimate health after 60. Many women unknowingly harm their intimate area during routine hygiene due to lack of accurate information. Common mistakes include using regular or antibacterial soap, excessive washing or scrubbing with sponges, vaginal douching, internal rinsing, using scented wipes, powders, or fragranced products. These practices disrupt pH, destroy beneficial bacteria, and irritate delicate tissues. Evidence-based recommendations. Use an intimate cleanser with pH 3 to 4, only for external vulvar care. Wash gently with your hand, without friction. Pat dry with a soft towel. Avoid scented products entirely. Wear cotton underwear and sleep without underwear several nights per week. According to Harvard Women's Health Watch, women who adopted gentler hygiene practices experienced significantly fewer infections and irritations. Pelvic floor weakness and regaining control. Involuntary urine leakage during coughing, laughing, or sneezing, or a sensation of pressure in the pelvic area, often indicates pelvic floor weakness, not personal failure. The pelvic floor supports the bladder, uterus, and bowel, and plays a key role in urinary control and sexual sensation. After 60, muscle tone and elasticity decline, especially after childbirth, prolonged inactivity, or chronic constipation. Pelvic floor strengthening, Kegel exercises. Empty your bladder. Sit or lie comfortably. Gently contract the muscles as if stopping urination. Hold for 5 seconds. Relax for 5 seconds. Repeat 10 to 15 times, twice daily. A study in the International Urogynecology Journal showed a 74% reduction in mild to moderate urinary incontinence in women over 60 after 12 weeks of regular Kegel exercises. Final message. Caring for intimate health is not indulgence, it is vitality, dignity, and self-respect. Aging does not mean accepting pain, dryness, discomfort, or shame as inevitable. On the contrary, this stage of life deserves more comfort, more pleasure, and more care. If this video helped you, please share it with other women, a sister, a friend, or a mother, who may have never felt safe asking these questions. Let us spread this information openly and confidently, because aging does not mean silence. It means embracing everything we can still become.